Welcome, everyone. Thank you so much for joining us today. I'm Amy Sam. I am the Health Education Project Specialist at the Maxwell Eleanor Blum Patient Family Learning Center at Mass General. Before we get started, I just want to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you're in listen-only mode. Everyone has mute so you can hear our guest speakers today. If you have any questions for our guest speakers, you may use the chat feature, which is located at the bottom of your screen. We'll have time for them in the end. Only Blum Center staff and our guest speakers will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. All right, so next I'm going to hand it over to Dr. Winnie Armand. She is the Associate Director of Mass General Center for the Environment and Health, and she'll get us started.
Thank you. Thank you, Amy Sam. And thank you, Blum family and the Learning Center for collaborating with the Mass General Center for the Environment and Health on this event. My name is Winnie Armand, and I'm a practicing primary care physician and Associate Director, as you heard, of the Center for the Environment and Health. Our center strives to address climate change and healthcare sustainability through how we deliver healthcare, education, research, and advocacy. So I will introduce our three speakers who are also wonderful colleagues. After their presentations, we will then have a panel discussion and include as many of the audience questions as possible. So the first speaker is Dr. Melanie Haynes, and she's an assistant professor in medicine at Harvard Medical School and a physician at Mass General. She received her degree from Dartmouth and her MD from Johns Hopkins and completed residency at the Brigham and Women's and did an endocrinology fellowship at Mass General. She is an NIH-funded clinical investigator with research interests in endocrine dysregulation and its effects on body composition and type 2 diabetes risk. She's also interested in the effects of climate change on endocrine health, including the effects of extreme heat and the effects of plastics and endocrine disrupting chemicals on body weight and metabolism. She's an active member in several endocrine societies groups related to these issues, as well as the Center for the Environment and Health, and she practices in the Neuroendocrine and Pituitary Tumor Clinical Center at Mass General. She will start by discussing the health effects of plastics and PFAS. Then we will go on to Dr. Anne-Christine Duhaime, who is a pediatric neurosurgeon at Mass General and a professor of neurosurgery at Harvard Medical School. Her research has focused on traumatic brain injury and recovery in children, and more recently on climate change, war, and health. Her longstanding interest in the relationship between brain, behavior, and environmental issues was explored in her recent book, Minding the Climate. She's an associate director at the Mass General Center for the Environment and Health, faculty associate at Harvard Salata Institute and at the Harvard Global Health Institute. And is Associate Editor-in-Chief of the Journal of Climate Change and Health. Dr. Duhaime will discuss the use of plastics in the health system. And then we will have Dr. Elizabeth Pinsky, who is a pediatric consult liaison psychiatrist at Mass General and also an Associate Director at the Center for Environment and Health, focusing on advocacy, and co-director of the MGH Climate and Mental Health Initiative. She's a founding member of Climate Code Blue, and which is a Boston area climate action group for physicians and other health professionals. And she strongly believes that clinicians caring for children must advocate for rapid and just transition off of fossil fuels. Dr. Pinsky will discuss ways to advocate for better policies related to these chemicals. And with that, please welcome Dr. Haynes.
Thank you so much, everyone, for the opportunity to speak today. I'm going to share my slides. Okay, can you all see the first slide in large screen mode? Great.
Yes, good.
Thank you. So these are my disclosures. I want to start by acknowledging that plastics truly are everywhere in our everyday lives. Global plastic production has increased almost exponentially since World War II. In fact, although the world's population has tripled since the 1950s, the production of plastics has increased over 250-fold in the same period. The mass production of plastics has led to a shift in plastic use away from durable goods to, quote, convenient, disposable, single-use plastics, as exemplified in this image from Life magazine in 1955. I want to recognize that plastics have conveyed some of the greatest benefits to humanity, making possible some of the most significant advances in medicine, electronics, aerospace, and construction. However, plastics are also responsible for significant harms to the environment and human health, which we will be discussing today. These harms to human health and the environment occur at every stage of the plastic life cycle, from extraction of coal, oil, and gas that are used to produce plastic, through the disposal of plastic in the environment, as shown in the top of this figure, from production to use to disposal. Predictions indicate that with projected future increases in plastic production, as much as 20% of all fossil fuels will be used in plastics manufacturing by the year 2050, resulting in increased greenhouse gas emissions that are driving climate change. The most rapidly growing segment of plastic manufacturing is single-use plastic, which now accounts for a whopping 35 to 40% of current plastic use. It's a common misconception that plastics are recycled, when in fact less than 10% of plastics are in fact recycled. Vast quantities of plastic waste are exported each year from high income to low income countries rather than being recycled. And ultimately, the ocean is the destination for much of the world's plastic. As shown in this figure, chemical and plastic particles leak into land, water, and air through all stages of plastic production, use, and disposal. In addition, wildlife and ecosystems are widely impacted by plastic waste, and human health is impacted at every stage of the process, from plastic workers and people who use plastic products to people that manage its waste. I want to stop and take a step back now and think about what actually are plastics. Plastics are complex compounded materials comprised of a carbon-based polymer backbone combined with chemical additives to create desirable features of the product, such as flexibility, stability, water repellence, and/or flame retardation. However, most chemical additives in plastics do not form strong chemical bonds with the polymer and therefore can easily leach out of the plastic. The sheer number of chemical additives in plastics is staggering, yet most are not subject to regulation. In fact, of the over 16,000 estimated chemical additives identified in regulatory databases as being used in plastics, only a minority are subject to regulation, while the majority lack any information about their safety and effects on human health. This is a diagram summarizing plastics' impacts on human health. At the top of this diagram is the plastic life cycle, which we reviewed in a previous slide. Workers who extract fossil fuels for plastics production or who produce plastics are exposed to a wide range of toxic chemicals, some of which have been associated with cancer. Plastic production causes air, water, and soil pollution, as well as greenhouse gas emissions. Direct population exposure to plastic chemicals and microplastic and nanoplastic particles, which we'll be talking about later, carries significant health risks across the lifespan and across organ systems. Lastly, environmental plastic waste that is degraded into microplastic and nanoplastic particles, as well as other plastic chemicals, accumulates in our environment and within our bodies, contributing to disease and possibly even serving to transport infectious diseases across time and space. Today, I'd like to focus on human exposure to plastic-associated chemicals and these microplastic and nanoplastic particles. As I mentioned, there are over 16,000 plastic-associated chemicals, and we will focus on a defined set of key exposures related to plastics, namely plasticizers like bisphenols and phthalates, flame retardants, and the per- and polyfluoroalkyl substances, or PFAS, also known as the forever chemicals. These chemicals are highly relevant as national biomonitoring surveys have documented the presence of bisphenols, phthalates, flame retardants, and PFAS in the bodies of nearly all people examined, including pregnant women and newborn infants. I will start by defining these chemicals and where they're found, and then highlight data associating these chemicals with a number of adverse health effects. So first, the plasticizers. Plasticizers like bisphenols and phthalates are added to plastic to increase its flexibility and make it softer, more pliable, and more durable. They can be found in canned food liners, plastic containers, cash register receipts, vinyl flooring, flexible PVC pipes, children's toys, food packaging, and some personal care products, as shown in the pictures on the bottom of this slide. Bisphenols and phthalates are prototypical endocrine disrupting chemicals, which means that they interfere with the synthesis, secretion, signaling, and/or metabolism of our natural hormones. In recognition of these effects, in 2012, the FDA banned the use of one bisphenol, bisphenol A, in baby bottles and sippy cups. But there are concerns that replacing one plastic-associated chemical, namely BPA in this case, with another, such as bisphenol S or bisphenol F, may also be associated with health harms. A second class of plastic-associated chemicals are flame retardants. Flame retardants are added to products and building materials to inhibit or delay the spread of fire. Common products that may include flame retardants are furniture foam, building insulation, textiles, carpet padding, wire and cable sheathing, airline interiors, car seats, and TV cases, as shown in the pictures below. People come in contact with flame retardants through direct contact with such products or when the chemical leaches into the air, water, or soil. In recognition of the health harms of flame retardants, which we'll be talking about on subsequent slides, in 2021, the state of Massachusetts outlawed some, but not all, flame retardants in bedding, carpeting, children's products, upholstered furniture, and window treatments. A third class of plastic-associated chemicals are PFAS. As I mentioned, these synthetic chemicals are called forever chemicals because they don't break down easily in the environment and may persist in blood for years after exposure. Thousands of individual PFAS are found in water, grease, and stain-resistant product, including carpets, food packaging, furnishings, nonstick cookware, cosmetics, outdoor gear, clothing, and firefighting foam, as shown in the bottom of this slide. In recognition of a greater appreciation of the health harms of these chemicals, which we'll be discussing, in 2024, the Environmental Protection Agency, or EPA, set strict limits for 6 types of PFAS in public drinking water supplies. This would go into effect in 2027, although the EPA is currently moving, unfortunately, to weaken its own limits on these chemicals. I would now like to turn our attention to a recently published meta-analysis that evaluated associations between human health and exposure to major classes of plastic-associated chemicals. One of the focuses of this paper, which was published in Annals of Global Health in 2024, was to analyze the previous literature on exposure to plastic-associated chemicals and birth outcomes, as infants in the womb and young children are 2 populations that are at particularly high risk of plastic-related health effects. This is because of the increased sensitivity of early development, like crawling and mouthing objects. Birth weight and spontaneous pregnancy loss or miscarriages. They found that higher prenatal levels of some phthalates, here in blue, flame retardants, here in green, and PFAS, here in gold, as measured in women, were associated with decreased birth weight in their infants. Other studies showed no change, although the direction of effect for flame retardants, as shown here, was generally towards a decreased birth weight, shown by the decreased arrows. The authors also found that higher levels of some phthalates, here in blue, were associated with increased spontaneous pregnancy loss or miscarriages in women. Although other studies showed no change, as shown here, the direction of effect was generally towards an increased risk of pregnancy loss. There are also additional data on associations of plastic-associated chemicals with child and adult reproductive health and fertility that we will not have time to review today. The authors also looked at the previous literature on exposure to plastic-associated chemicals and neurodevelopmental outcomes in children. They found that higher prenatal levels of flame retardants, here in green, and some phthalates, here in blue, in women were associated with decreased cognitive development and IQ in their children. Other studies with phthalates showed no significant association, although the direction of change was generally towards decreased cognitive development. The paper also included an analysis of the previous literature on the association between plastic-associated chemicals and endocrine outcomes, namely obesity and type 2 diabetes. The authors found that higher levels of BPA, here in purple, and some phthalates, here in blue, have been associated with obesity in both children and adults, while other studies did not show a significant change. In addition, higher levels of BPA, again here in purple, and some phthalates, here in light blue, as well as flame retardants, here in green, have been associated with an increased risk of type 2 diabetes in adults, while other studies showed no significant change, although the direction of effect in these negative studies was towards an increased risk. Next, the authors analyzed the previous literature on the association between plastic-associated chemicals and heart health outcomes. They found that BPA, shown here in purple, and some flame retardants, here in green, in both children and adults were associated with a higher risk of high blood pressure or hypertension, whereas other studies showed no significant change. They also found that higher levels of BPA, again here in purple, and some flame retardants, again here in green, in adults were associated with a higher risk of cardiovascular or heart disease, whereas other studies found no significant difference. Lastly, the authors analyzed the previous literature on the association between plastic-associated chemicals and cancer outcomes, specifically focusing on flame retardants. They found that higher levels of some flame retardants in women have been associated with breast cancer, as well as non-Hodgkin's lymphoma in both children and adults, whereas other studies found no significant change. I now want to pivot and talk about microplastic and nanoplastic particles, which is an emerging area of interest. These microplastic and nanoplastic particles, or MNPs, are very small particles that are formed from the breakdown of plastics. They are ubiquitously present in the environment and have been detected in air, soil, water, and food samples. Increasing numbers of studies report the presence of MNPs in multiple human tissues and body fluids in the general population. And an emerging body of evidence indicates that MNPs may cause inflammation and oxidative stress in multiple tissues due to either physical accumulation and or transportation of chemical additives into cells and tissues with the microplastic or nanoplastic particles. Lastly, MNPs have also been shown to be colonized by bacteria and may help breed antimicrobial resistance, as well as facilitate the transport of bacteria in the environment. Successes achieved in the control of other environmental health threats, such as air pollution and lead, offer us lessons in terms of how to control plastic pollution and its adverse effects on our health. For example, clean air legislation has reduced ambient air pollution in multiple countries, and lead has now been removed from automotive gasoline in every nation, resulting in sharp reductions in children's blood lead levels and increases in cognitive function among children. Dr. Duhaime and Dr. Pinsky will be speaking later about what MGH and the Commonwealth of Massachusetts are doing to reduce health harms associated with plastics. But I wanted to end my own talk with discussing actions that you can take in your own home to reduce your exposure to plastic-associated chemicals and microplastic and nanoplastic particles. So in terms of things to do, here on the left in green, one thing to consider is having or obtaining a water filter that's certified to reduce microplastics as well as PFAS in your drinking water supply. It's important to note that not all water filters carry this certification, so it's important to check labels and do your research. Also, washing plastics by hand if you have them, rather than putting them in the dishwasher, is important in order to prevent the leaching of chemicals out of the plastic. You could also consider using wooden instead of plastic cutting boards, as well as opting for non-stick cookware alternatives like ceramic or cast iron pans in order to reduce exposure to PFAS. Washing your hands before eating is, of course, important, not just from a hygienic point of view, but also reducing exposure to plastic and plastic-associated chemicals. As I may have mentioned, dust is a frequent source of home exposure to plastic-associated chemicals, including flame retardants. So dusting and vacuuming frequently with a HEPA filter when possible is something to consider. We know that washing synthetic clothing can leach microplastic and nanoplastic particles into our water supply. So washing synthetic clothes in cold water can help reduce the leaching of microplastics into our drinking supply. Choosing non-plastic home goods when possible is also something to consider. And in general, reading labels and knowing what's in the products you buy is what is probably the top piece of advice that I have. In terms of things to avoid, and here on the right in red, in general, the summary here is just, although plastic is ubiquitous in our environment, in our life, avoiding it in situations when you can is the optimal choice. So cutting back on bottled water and avoiding plastic packaging. Avoid storing food in plastic when possible. Avoid using and reusing single-use plastics. And not heating plastic. Don't put it in the microwave. Don't put it in the dishwasher. I wrote here minimizing consumption of ultra processed food, just because the production and packaging of ultra processed food often involves plastics, as well as avoiding BPA containing thermal paper, such as some store receipts contain BPA, and avoiding fragrances, specifically fragrances associated with plastic products, as the fragrances often have chemicals that are undisclosed and therefore may be worth avoiding. So I will end there. With this last slide, that includes some links for resources if you're interested in learning more. The Environmental Working Group, or EWG, is a nonprofit organization that researches and advocates for policies and products that are safer for the consumer and for the environment. Endocrine Society has a very nice endocrine disrupting chemicals webpage that includes links and videos to learn more. And the Program on Reproductive Health and the Environment at the University of California, San Francisco has a very nice website, and their mission is to create a healthier environment for reproductive health and development through science, clinical care, and advocating for health policies for a healthier environment for our current and future generations. So from there, I will stop sharing and pass it off to Dr. Duhaime.
All right. Thank you, Melanie, and thank you, Dr. Armand, for the introduction. Let me share my slides. This will be very quick and practical about certain strategies that some hospital systems, including our own, has instigated to try to reduce healthcare plastics. And we'll cover just briefly what hospitals and clinics can do, and also what people that do biomedical research can do. This is a really nice resource, this paper that came out in 2020 by Chantal Razan, who is actually an ENT surgeon in the UK. And the middle graph here shows, it's a little bit hard to read, but I'll walk you through it. It is a graph on the top of the years at which plastics were invented. And so the horizontal axis goes from 1860 to 2020 and shows that the first plastics were discovered in the late 1800s, and gradually, particularly around the 1940s through the 1960s, new kinds of plastics were invented. And in those little boxes, it tells what the healthcare use of those various plastics were. These are things you would all recognize. You know, it's what makes endotracheal tubes and urinary catheters, and in my business, shunts and external ventricular drains and synthetic cranioplasties. Each of us in our work, whether we're researchers, clinicians, or people in the public, know that there is a lot of plastic around. And that top graph shows the increase in plastic global production over those same years. And you can see that there's a real inflection point around 1970, 1980. And the vertical axis here is in megatons of plastics. So in 2020, there were almost 350 megatons of plastics produced globally. So as Dr. Haynes said, it's a really big amount of stuff. The second figure down at the bottom on the right, this is one example, and again, it's from the same paper from Dr. Razan, showing 101 single-use pieces of plastic in one typical adenotonsillectomy surgery. And one of the questions is, do we really need all that stuff? Plastics comprise about 30% of healthcare waste and an estimated 1.7 million tons in the US per year. So you've all heard this phrase, reduce, reuse, and recycle. And if you're like me, when I started down this path, I thought the answer was recycling. But as Dr. Haynes pointed out, it turns out there are better ways. Recycling is sort of a last resort. So let's start with reduce. In healthcare, how do we reduce the plastic that we use? Well, we'll get to the punchline in a few slides, but really it's about considering whether or not we really need everything that we open and throw away and utilize. So can you just use less? And then if you yourself, for your job, to get your job done, really can't reduce any more than what you have, or you don't have a whole lot of leeway there, can we incentivize our suppliers to either use less plastic in general or to manufacture it with less waste up front? So here are just some examples from our local environment. One was an audit that our pediatric intensive care unit team did several years ago, where they just looked at how much stuff got thrown away from an in-room intubation process. And they tracked everything that they brought into the room, everything they opened, and everything they threw away. And they found out that they could reduce this significantly simply by not bringing things into the room and simply by not opening things that they ended up not using. And you know, in healthcare, even in research, that there's always a tension between wanting to have things that are readily available, they're sterile, they're right there at your fingertips when you need them, because our patients are often in crisis, or your laboratory process counts on exquisitely sophisticated timing. Everything has to be in the right place at the right time. But this team found that they could reduce their discarded plastics, their used plastics, for an in-room intubation by about 30%, just by rethinking what they really needed, and without any sense of a decreased safety and efficacy of the process. There is a gloves off campaign. There's a little poster about that in the bottom left of your screen. This is an international effort where we have had a tendency, in part because of fear of transmitting or catching infections, to use gloves for more and more things. But we need to question that. So this campaign, the Gloves Off campaign, is an education campaign that basically says, what have gloves been shown to be useful for? What are they actually counterproductive for? So in the lab research buildings where I spend a lot of my time, there are now signs on the door saying, don't touch this handle with a gloved hand, because that's how you spread infection. So sometimes the gloves feel protective, but they actually make things worse. So this is an education campaign, and gloves is one of our big plastic discard items by weight, when you look at it by weight. I was very pleased to get a new computer laptop through my hospital. It's part of my work because I see patients in clinics that are not always right in my office. And we happen to use Dell computers. And when I got my new computer, which came, by mail, it was entirely in cardboard cardboard packaging. And this is not to advertise Dell or anything else, but I was pleased to see that. And that in part comes from pressure on industries from people who are concerned about plastic waste. I happen to direct a program here that connects our lab researchers to an external company, a nonprofit called My Green Lab, that is designed to try to make laboratory research and research in general, it can be clinical research, more sustainable. They have a certification process that includes these 14 different topic modules that you see in the bottom of your screen here. And this gives labs and researchers customized ideas about how to reuse their plastic, how to reduce their plastic use. There's one example shown there where there's a company that makes very thin, low amount plastic pipette liners instead of throwing away an entire hard plastic box each time you change your pipettes. Another big point is don't throw things in red bag in hazardous waste that don't need to go there. It's many times worse environmentally and many times more expensive. And when we have done waste audits in the labs and on our floors and units, we have found that a lot of times people are throwing things away in biohazard bags that really don't need to be there. So each institution may have its own rules. Some of the rules are statewide, some of the rules are federal, but many of them are institutional practices that are passed down from one generation to the next without anybody really checking whether something actually needs to go in red bag waste or not. And you can cut down that particular hazard, which is much worse environmentally. So that's all about reduction. Let's talk about reuse. There has been a considerable amount of attention to trying to use reusables versus disposables. Now, in the 1990s, 2000s, there was a lot of push, and even continuing today, for companies to make products that are disposable products. They can be convenient, they can be easy, they're sterilized, you just open the package, you have everything you need. This is particularly true in my area of surgery. And there's been a huge push by manufacturers to make things that are disposable. And infection control likes that for the obvious reasons. But the question is, do these things add to the plastic waste? And the answer is, in almost every assessment that has been done, they both add to the plastic waste and they add to the environmental footprint overall. And oftentimes they are not really cost effective. So some examples of things where there are issues with handles and reusability and certain kinds of regulations that we have tackled in our hospital are laryngoscopes, disposable versus reusable, specula. This is something Dr. Armand has worked on. Various kinds of endoscopes for inpatient and outpatient use, plastic isolation gowns. This really became a thing during COVID. And so there are issues of all of these things, but it takes some time and effort to figure out what you can do in your own setting to reduce the reusables, reuse disposables and try to switch to reusables. And there are strategies, gather the data, including the financial implications, see what other similar institutions do. We were able to make some progress by saying that an institution across town didn't do it that way. They used reusables, and that helped push the needle in our own institution. Team with decision makers like purchasing, and it takes patience and persistence. Recycling, as Dr. Haynes said, is generally the least effective. There are some gains. Some hospital waste vendors do some recycling, but you have to have experts that can tell you whether this is actually good environmentally from the overview. And most clinicians don't have this, so you have to find partners who can check this for you. Some hospital programs for recycling, such as Blue Wrap in the operating rooms, have been successful. Some labs contract themselves with recycling companies. One that's local here to Boston is Green Labs Recycling, which some labs pay extra to use. And encourage those around you to know and follow what's already available in your own center. A lot of times people don't know and they don't do it correctly. You have to be aware of what determines the environmental impact overall. So this is just an example of a study that was done on operating theater environmental footprint, and what actually makes the environmental footprint, which is on the vertical axis, really varies from place to place. It's the same operation, but in one location, it's the orange, which is the greenhouse gases because it's a coal-fired location. And in the other, to the left, it's the anesthetic gases because that's what they use and the other things are taken care of. So it's the same with plastic waste. You need to know your local environment and what the environmental footprint of your overall operations are, including the amount of plastic waste. So in conclusion, there are ways to reduce your healthcare plastics. Most employees do care about this subject and want their institutions to care too. We've learned that from surveys. It does take time and commitment. And the whole goal is to move our healthcare systems from the bottom diagram here of when we always cared about efficacy, cost, and safety, now to also include environmental impact as part of our overall scheme. So I'll stop there and I will turn it over to my colleague, Dr. Pinsky.
Hi there, everyone. Thank you so much, Tina and Melanie, for that awesome information, and to Winnie for the introduction. I'm very excited to be here with all of you today to talk about sort of some of the opportunities that we have for advocacy in this space, both as clinicians, but also just as citizens of the world who are living with PFAS and forever chemicals. I'm talking a fair amount about PFAS during this presentation, but oftentimes many of the other plastic-associated chemicals that Melanie talked to us about fall into the same sort of advocacy areas. So just to give like a brief timeline of when advocacy started around plastic-associated chemicals, it was really sort of in the very, very late 20th century and early in the aughts that the public increasingly became aware of the dangers associated with PFAS. And then starting about 10, 15 years ago, there started to be increased concern and also some legislative and regulatory action. And then over the last 5 years, there's really been a lot of activity on both the state and federal level to restrict PFAS, for example, in military firefighting foam, which was a federal decision. The EPA, as Melanie mentioned, did finalize some drinking water regulations back in 2024 that should be going into effect in 2027. There was a whole bunch of sort of action around these things that, unfortunately, because of some things that are happening at the federal level now, including at the EPA, may be getting reversed. So there has been discussion at the EPA about a proposal to roll back the scope of those drinking water regulations that were passed back in 2024, and also a rollback of the regulations around military PFAS in military firefighting foam, which are from all the way back in 2019, 2020. So that is a little bit of a bummer, but the fact of the matter is that federal action is kind of slow and clunky to begin with. And in many ways, the states are where there's a lot of power in all of this. And Newsweek did me a favor just last week, publishing this op-ed, "A Fight Over Forever Chemicals Shows Americans Can Still Unite." And to me, that is a really, really hopeful piece of things, thinking about the PFAS advocacy pictures. PFAS is really a bipartisan concern. If you look, again, talking about the federal level, the Congressional PFAS Task Force is large and has members from both parties, and the chairs of the task force are actually both Republicans and Democrats. There's been a variety of proposed federal legislation on PFAS, everything from getting Medicare to pay for PFAS testing to doing things to protect our military from PFAS. And again, those have been bipartisan proposals. Looking now at a state level, you can see here that all of the states that are shaded in green and blue, the attorney generals of those states were almost always elected officials, a few states where they're appointed. But by and large, these are elected attorney generals in these states that are some red, some blue, and some purple. And they've all either initiated or settled litigation with chemical manufacturers about PFAS and forever chemical contamination. So this really is an issue where we can unite and make progress sort of wherever you are in the country. Thinking about, in general, what we're asking for when we're thinking about either regulatory changes or legislative changes, we chunk things sort of into these big 6 general PFAS advocacy target categories. So we need stronger regulations. We need more bans on more chemicals, need to expand the number of chemicals that are banned, and really importantly, mandate disclosure or transparency for the public and for consumers about what they're getting. So we need stronger regulation. Making testing available is really important, not just for municipalities who may have public water systems, but also for the many, many people in the country who have private wells that may have been contaminated not due to the homeowner's fault, but due to discharges of PFAS into groundwater or surface water. Accessible treatment, once PFAS has been identified, it is incredibly expensive to remediate for these chemicals and to get them out once they are somewhere. So making sure that, again, just residential customers have access to free or subsidized filtration, that when there's a really significant contamination, that people have access to alternative water sources, and really importantly, making sure that the vulnerable communities, who in this country tend to be Black and Brown communities, and then also rural communities, aren't experiencing repeated contamination and inability to remediate what has happened to them in what we call environmental justice communities. Oops, Daisy. Research and monitoring. There's limited long-term health studies, especially in terms of the populations that have been exposed to the highest level of these chemicals. Polluter accountability, which I'll talk about a little bit later, making sure that the industry is helping to do some of the cleanup and some of the monitoring of the chemicals that they put into the systems. And then making sure that we're advocating for public education. So the community and consumers, again, are aware of what they're purchasing and what they might be being exposed to. And then really importantly, healthcare provider training, relevant to what Tina was talking about. So those are all of the advocacy targets. Here in Massachusetts, what I would say is that there's many ways in which we have been a leader. We have a very strong drinking water standard. As Melanie mentioned, we did ban flame retardants in some textiles and children's products back in 2021. But we still have no requirements around private well testing. We still have a lot of chemicals that either are not regulated, and then limited liability for polluters. So for those of us who are here in Massachusetts, this is the current PFAS bill, an act to protect Massachusetts public health from PFAS. I've listed here the sort of key elements of the bill, but you also have a QR code there if you want to link to it and read the whole text of the bill. It has many, many good and important pieces to it. In terms of the PFAS remediation fund, this is going to be a very, very expensive project. And so making sure that we have enough funding to do what needs to be done to protect our communities is going to be an ongoing issue. But overall, it's a good bill. The Alliance for a Healthy Tomorrow had impeccable timing with this webinar. It has just launched a toolkit for people who do want to take action on PFAS here in Massachusetts. The website is right there. And then once you have that toolkit from Alliance for a Healthy Tomorrow, that QR code will take you to your state legislators so that you can ask them to vote in favor. For those of us who aren't in Massachusetts, saferstates.org is a national alliance of environmental coalitions that can help you find out what's happening in your state, track proposed legislation, and figure out what might be the opportunities to engage with policymakers to make sure that things are heading in the right direction in your state. One of the other levers that we have is as consumers. And so I'm just giving you guys a few different resources. Toxic Free Future has a campaign called Mind the Store that tracks what large corporations are doing in terms of their own actions on plastics and other toxins. I love it always when there's like a hall of shame. So they have a list of, I think, 20 corporations that really are not doing what needs to be done to make sure that they're protecting and being transparent with their customers on plastics and toxins. And then just sort of big picture, we know that chemical manufacturers are responsible for all of these chemicals that are in our environment and that need cleanup. And that is not who is experiencing the consequences. Most important, of course, are the health consequences to children, to firefighters, to farmers, to people in the military, and to those living in environmental justice communities. But there are also enormous financial repercussions and other consequences for all of these people, just as taxpayers. The fact of the matter is that cleaning up these chemicals, delivering clean water, testing, providing healthcare to people who have gotten sick is going to be colossally, colossally, colossally expensive. And so this website, nonsticknightmare.org, you can go in and you can type in your state and find out what have been the costs already of cleaning up PFAS in your state. And there's a variety of actions you can take there to try to make sure that chemical companies and manufacturers are responsible for some of the cleanup costs associated with this. I'm going to close with just one sort of second timeline. I opened with a timeline on PFAS advocacy that started in 1990. This looks at what awareness the chemical industry had prior to 1990, before there was sort of public awareness and concern about PFAS. And, Tina mentioned, plastics have been on the, in the, nonstick pans have existed since for decades. And the fact of the matter is that the chemical industry had mounting reason to have concerns, suppressed data, and were not honest with the public about what were likely the risks of these supposedly inert materials for decades. And so in my opinion, these companies made a lot of money and experienced great benefit from being able to sell these chemicals, and that should not all come on the backs of taxpayers. So that was a whirlwind trip through PFAS advocacy. I'm hoping that this baby can inspire everyone to get out there and take some action now, and really looking forward to some conversation with folks who are on the webinar in our Q&A. Thanks so much.
Thank you all. That was incredible. I really appreciated all of your talks. And I have to say, for me, listening to this, it was great to hear from the perspective as a person in a household, what you can do to try to protect yourself from these chemicals. In the hospital, as in the health system and research labs, what we can do. And then finally, as advocating for policy change. And then the one thing that just strikes me also is that the market really responds to consumers. And so I think as consumers, when we buy things, asking for transparency and action from companies, if we can't rely on policies from the government, we can hope that the market will respond to us as consumers. But on that note, there were a couple of questions in the chat, and I welcome the audience to put more in. For the next 10 minutes, we can discuss some of these. One of the questions that came up was about the biodegradable plastics. And I wondered if any of you can talk to how they function in terms of health impact, whether they're useful either in the household or in the hospital. And if there's anything we should be aware of in terms of policy or legislation around biodegradables.
Sure, I can start. So biodegradable plastics are some of the newer kids on the block. They're marketed so with the idea that they may break down more rapidly in the environment because they are, quote, biodegradable, and thus are in the environment for less time, and also reduce the use of fossil fuels in their production. However, I would say that there is a lot of information that we don't know about biodegradable plastics. One, and also that there have to be, oftentimes a specific environment is required in order for that plastic to biodegrade. So it's not going to biodegrade, or some of them at least are not going to biodegrade in your home compost in your backyard. So it's not quite as optimistic as it's marketed to be. And the health effects of biodegradable plastics, I believe, are not as clear, but some data suggests that they still break down into micro and nano size particles that can accumulate in the environment and in our bodies. And although there's not clinical level data to suggest an adverse effect, there are some preclinical level data to suggest that those biodegradable micro and nanoplastics may induce the same sort of inflammation, oxidative stress on our body as the, quote, traditional microplastic and nanoplastic particles.
Yeah, I can jump in on that too. We looked at in our hospital biodegradable plastic bins to use in the operating room. So there are these sort of round basins, is the word, not bins, that we use all the time. In every OR, there are several of them to hold instruments or to have irrigation fluid. And it turned out that, as Dr. Haynes said, the process they were expensive. The process to cause them to recycle was a very specialized process. And it ended up that it was really not cost effective to use them. That doesn't mean that we shouldn't encourage more exploration and development in this area, but I think it's also worth pointing out there's a difference between bioplastics, which are made out of biologic materials, and biodegradable plastics, which are designed to break down, but may require specific processes. And even the bioplastics that are made of biologic material, they may not have the properties unless you treat them or add something else to give them the properties that they need. So more to follow here. It's not a bad idea, but you have to be aware of greenwashing as well. Would you agree, Melanie?
Yes, absolutely.
Thank you. So a couple of the attendees are curious about or concerned about the microplastics that are already in the body. Dr. Haynes, I know you went through already what types of things can be done to try to limit exposure to the chemicals in plastics, and some of the discussion of how to filter out microplastics. Is there anything else to suggest? And then specifically, if it's already in the body, anything you can do? One of our attendees is commenting on the cardiovascular risks related to the microplastics found in arteries.
Yes, so there was recently a New England Journal of Medicine paper that showed that microplastics in the plaques in our arteries increase the risk of rupture and cardiovascular events, which was a very high profile paper. I would say that unfortunately, there is not currently any evidence-based way to remove the plastic associated chemicals and microplastics or nanoplastics from our body. I will say though that the half-life of these things is very variable. So from, unlike PFAS, which we know can have half-lives on the order of years, the plasticizers like bisphenols and phthalates are metabolized in our body and excreted in the urine within 24 hours of exposure or ingestion or inhalation. And so there have been studies that have shown that taking steps to reduce your exposure can have a very short-term immediate impact on the levels of at least the bisphenols and phthalates in your system. So I would say with the limits of what we know and the science that we have, it's really all about reducing our exposures because we don't have evidence-based guidance on how to reduce the actual levels once they're in our system.
Thank you. And another question here is about when a mother is exposed to these chemicals and in their children. You had alluded to, Dr. Haynes, some of the outcomes, poor outcomes with childbirth, but any more evidence related to disorders like autism or other neurological or conditions that are seen in the children of mothers with high exposure?
Yeah, these are very difficult studies in part because autism, and I'm not a neurologist nor a pediatrician. So, I think that these studies are very difficult in terms of there's not a randomized controlled trial here. So you're trying to compare exposures and also identifying exposures where the half-life of some of these things is on the order of hours, and then connecting it to a disease is very difficult to do. And so maybe I'll also ask Dr. Pinsky to weigh in if she has any further comments, but this is a really complex area, of course, a very heated area right now that's common in the media. And I will just say that I think that more science, more good science is needed here, because these types of causal, a cross-sectional association does not necessarily mean causality.
And I would just throw in, I am not expert on this particular form of pollution, but certainly air pollution and other forms of inflammatory toxins that we know that both pregnant moms and very little babies breathe have been associated with neurodevelopmental outcomes. And so there certainly is more of a plausible biological connection in this that would demand more good study to get the answer to the question than there is in some of the other theories that get entertained in 2025. That's what I would say.
Yeah, I think you make the point of the acceleration of the amount of these products that have happened in the recent decades, and oftentimes the science lags a little bit, and but that's also accelerating, and hopefully there will be more information. What is a little frustrating is oftentimes one chemical is just replaced with another chemical, and then there's another lag till we find out about that. I think all this is extremely overwhelming. We have just a couple minutes before Amy Sam will close us off, but as I'm speaking, think about your one advice for our listeners. I think that it can be very overwhelming, and it can feel probably scary for some people. But I think my thought take home is just oftentimes just doing the easy things and don't worry about the hard things so much. So I'm curious from each of you if you would offer, if you have your one thing of what you would want our listeners to take home or to do.
From an advocacy perspective, I always say that the first step is finding an effective group and taking one bite off the apple. So I shared a number of links today, and Amy put some in the chat, going to Safer States and finding one form or petition where you can send in and communicate with your legislators and policymakers today, right now, can be a way to sort of get your advocacy ball rolling.
And I would say from the using plastics in the healthcare system, the simplest thing you can do is find other people who are interested in this, work together, find someone in your hospital that will listen, because oftentimes the people that will listen are the financial people, because reducing what you use also saves cost, which administrators typically are favorably disposed to listen. So that's one way to cut down our amount of plastic waste, which is extraordinarily big. You can find a campaign like the one about using less gloves. They're easy to import into your own healthcare system. Melanie, what's your advice?
Well, I would first say that I personally often feel overwhelmed in the personal decisions I have to make in this area. So just to echo what Winnie said, and the way that I have handled it is along the lines of what has been said previously, and just in terms of making incremental changes and knowing that honestly, at this point in time, it's impossible to eliminate plastic from our life. We're unfortunately not there. But incremental, small changes can have a lasting impact in your own, personal consumer choices and your own personal health. And so I think being able to see the silver lining and appreciate any small changes that you and your household can make.
Wonderful. Thank you. Amy, Sam, thank you for having us. I welcome you to wrap up for us.
Thank you. Special thanks to Winnie for moderating today and our experts who provided their insights. Thank you so much. This is all extremely helpful. And for everyone who joined us today, thank you so much. Hopefully you found today's session helpful. As I had mentioned, today's session is being recorded. It'll be made available on the Blum Center website at massgeneral.org/Blum-Center. I would give it about 2 to 3 weeks. It'll be posted on there. I also dropped that link in the chat. And I believe that's it for now. Thank you so much, everyone. Take care.